These exercises can help you increase strength and improve bone health faster than you think. If you are over the age of 75 and suffer from osteoporosis and feel like you are being robbed from all the beautiful things in life, then this video is for you. Osteoporosis is a disease that weakens the bones, especially as we age, and unfortunately has a high morbidity rate. 1 in every 3 women and 1 in every 5 men will suffer a fracture caused by osteoporosis sometime during their lifetime. So in today's video, I'm going to show you 6 exercises that you can do safely in the comfort of your home that's going to help improve your bone health. So before we get started, all you need is a chair and some TheraBands. Different colors, doesn't matter which one. And also, one more thing. It's always a good idea to speak to your healthcare provider just to get the go-ahead for you to start doing your exercises. Let him have a look and see whether you are clear to go. So let's kick off with our first exercise, and that is the chair thoracic rotation. So all you need is a chair, and I want you to sit on the edge of the chair. So you don't need the backrest for now. I want you to sit nice and upright, and the first thing I want you to do is take a deep breath in and out, and feel that every time you breathe in, your chest rises. And I want you to pick up your chest, drift the shoulders back nice and easy, and then place your hands on the bottom part halfway between your sternum and your lower ribs, and you'll feel that there are 2 bumps, and those are the bottom ribs. And as you breathe out, I want you to rotate for me as far back as you can, and the hand that's on the ribs here can actually feel the rib cage moving. Okay, keep that chest nice and up. I don't want you to slouch and do this rotation. You'll find that you won't get enough range. So pick up the chest, bring the shoulders back, breathe out and rotate, and see how far you can rotate towards each side. Every time trying to go a little bit further. And you also want to match your left side versus your right side. You want to go as much to the one side as you go to the other side. And we can repeat this 10 times. Come back, breathe in. And one more, breathe out. And you can even hold it there for a few seconds. Take a deep breath in and breathe out, and see if you can actually go a little bit further. And come back and relax. And this brings us to our next exercise. This is a squat thrust with a toe raise and a heel shift or a weight shift onto each heel. So this is how we're going to be working this. This is very important that we can control going on the way down nice and slowly, and then explode upwards very safely, of course, on your own pace, and then shift your body weight from your left to your right to place emphasis on all the joints on each side of the body. Sometimes we favor our left leg more than our right leg. We press a little bit more with our one side and the other side, so that we actually compensate and let the weaker or the more painful associated knee, hip or lower back get or do less of the work. So what we're going to be doing is we're going to make sure that doesn't happen. So we start with our feet placed just slightly outside shoulder width. Use the chair for support. And then what I want you to do is I want you to push your hips back, go down slowly, and I want you to count to 4. 1, 2, 3, 4. And then I want you to explode up as fast as you can. But remember, do it safely. And if it's your first time, start off with a normal speed, and then you can actually accelerate up. Then shift your weight over onto your toes still. You're staying there, and then come back towards the other side. Back down, heels down. 1, 2, 3, 4. Explode up. Shift, shift, and down. 1, 2, 3, 4. Explode up onto the toes. Shift, shift, and we repeat. Breathing in on the way down. 2, 3, 4. Explode up. Shift, shift. Now what you are actually teaching your body is to jump. You are doing a jump, but you are not leaving the floor, and you're also shifting your body weight over onto each side to place just enough stress on those metatarsals on the foot and the ankle, moving up all the way up to the knees and hip. explode up to just teach your nervous system that this is actually a fast, explosive move. And now we are landing slowly, 3, 4, up and shift and down. Slowly, 1, 2, 3, 4. Now, if you cannot go down that low, that is okay. You can just go as far as you feel possible. The more you do this, the more comfortable you'll feel, and you'll be able to do this much easier. And you will eventually be able to lift the one foot off the ground, lift the other foot, come back down and down, up and lift it. Remember, this is only once you are comfortable with doing it the original way. And let's do one more. Right, down, breathe in and up and shift. I'm just doing the normal shift here. I'm not lifting, and relax. Let's move on to the next one. Our next exercise is a standing banded row. Now, you can choose any form of band that you've got. They vary in different intensities, so I'm just going to pick the green one as a good example. All these exercises, just as the exercise before, the squat and the explosive thrust with the heel lift, was designed to teach you impact, to make your exercises a little bit more to a higher level, to take high impact, like a jumping activity. So first of all, we're going to take the band and we're going to wrap it around something. It could be a doorpost or a pillar. And the reason we're doing this standing, because I want you to feel that actually your body weight is moving through, and it's not you just sitting on a chair and working the muscles between the shoulder blades. Another thing we're going to be doing is we're going to stagger your stance. So we're going to stand with the one foot in front of the other one, not too narrow and also not too big of a step, just a 1 foot distance behind each other. Once again, we're going to lift up the chest, get the shoulders back, and we're going to soften the knees, and we're going to pull and row, bringing that chest forward and the shoulders back, getting a good squeeze in the back. And we're going to hold for a second or two and breathe in and out. And again, we can speed up the movement going into the pull, slowly forward and pull. 1 second. Okay, slowly forward, 2, 3, 4, and pull. Count again, 1, 2, 3, 4, and pull. Breathing out at the top of the movement, giving it a squeeze for a second. 1, 2, 3, 4, and fast. Okay, 1, 2, 3, 4, and fast. Teaching those muscles in the back that this is an explosive movement. Pull and pull. And we keep doing this 10 to 15 repetitions. Then, once we swap sides, I want you to switch legs as well. Because you can actually feel the one leg is doing a little bit more work than the other leg. The leg that's in the front will do a little bit more pushback to keep your body nice and still, so it does work a little bit harder. This way, we're not only getting the muscles in the back of the body, but also the bones and joints of the upper body, and at the same time, we're getting in some leg workout as well. 2, 3, 4, and pull. 1, 2, 3, 4, and nice and fast. 1, 2, 3, 4, and let's do one more. 1, 2, 3, and 4. And that is the standing banded rows. So now we are going to attempt to do the opposite. Now we're going to push explosively and come back eccentrically, nice and slow, so we get work done on the chest muscles in the front and the shoulder joints. So we just take our same band, we tie it around, and we get a sort of a grip where the band comes in from the outside of the wrist. Again, we take a step forward so that we got 1 foot, and I'm actually pushing off my heel, off the back. My heel is actually off the floor, so that I'm actually pushing my body weight onto the front leg a little bit more. And you can see my chest is already in a forward position with my shoulders back. That's where I want you to start the movement. And then from there, we're going to breathe out, nice and explosive, come back 4, 1, 2, 3, 4, and explode out. 1, 2, 3, 4, breathing in and out, and back, 1, 2, 3, 4. And we can repeat this for 10 to 15 repetitions as well. I will put the sets and the reps at the bottom of each exercise so you can just follow along. We'll do one more. 1, 2, 3, 4. Now you might maintain a good body upright posture, shoulders back, spine extended, chest out. And when you're moving, I want your body to be completely still and only your arms shooting forward and coming back. When we move on to the next set, we just swap legs around so we get the one leg chance to work just as hard as the other leg. Push yourself over onto the front foot and 1, 2, 3, 4. Hold it there and push. Fast out. 1, 2, 3, 4. And 1, 2, 3, 4. You can feel the chest muscles working already. And you feel the shoulders. 2, 3, 4. And we'll do one more. 1, 2, 3, 4. And relax. Make sure that the band is shoulder width behind you, that it's not coming from a too lower angle. So make sure that you tie the band at least shoulder height from wherever you are, if possible. You can modify this if standing is too difficult for you or you have balance issues. You can actually sit in a chair and do this as well. And this brings us to one of my favorite exercises, which incorporates balance as well as strength work. Now, what we need is our chair again, and we're going to stand and make sure that we've got constant contact with the chair in this position. Then from here, you can take your hands away, shift over to the one leg and reach forward, lifting the other leg, keeping balance on the one leg, and then come back up again. Try not to put the foot down on the ground. You can touch just the toe very lightly and then move on to the next repetition. Same leg and come back down. See how my upper body is moving forward the higher I lift my leg. I am not actively trying to get my body to lean forward and then lift my leg. I'm actually only tilting forward when my leg starts moving. And I'm actively picking up my leg behind me so that I can bend forward. It is almost as if I'm locked in position. Touch the chair and come back up. I know this is a very challenging exercise, so you can keep your hands in contact with the chair to start off with. Then out, breathe in and out, and you can hold it there for a second if you can. It is a very difficult and strenuous exercise. This is going to place a lot of emphasis on the hips, pelvis, and back. Very good to strengthen the entire kinetic chain from the foot all the way up to the lower back. And let's do one more. Breathing in. Still haven't touched this leg on the floor, and I can actually feel my hips on the other side burning all the way down to the ground. And one more. And come back and relax a bit. This is a strenuous one, so take a bit of a break in between, maybe 30 seconds to a minute, and we move on to the other side. Keeping contact if you don't feel your balance is where it should be yet, but eventually you will be able to take the hands off the chair, just keep them floating above the back of the chair, and then as you go down, you touch, rest lightly on the chair, come back, and again, only tilting forward as soon as the leg starts moving towards the back. You don't want to just use your upper body to bend before the leg moves. And the higher you move your back leg, the more the glute on that leg will work. So get that glute up and bring it back down. Let's go for two more. Breathe out. Ooh, I can feel a good burn on this hip. And one more. And as well on the opposite side. And down. And this brings us to our last exercise, and it is calf raises to strengthen the ankles, the toes, and also work our way up to learning to take impact once we want to get into a little bit more advanced exercises for our osteoporosis. So what we're going to be doing is find our chair, place our feet next to each other, and what we do is we go up as high as we can onto the balls of our feet, and then slowly down. And we also want to speed the upward portion. We want to go as fast as we can and then slowly down. 1, 2, 3, 4, and up. 1, 2, 3, 4, and fast up, just like we did with the squat and thrust. Up. 1, 2, 3, 4, and up. 1, 2, 3, 4. If this is too easy for you, we can learn how to do it with one leg. 1, 2, 3, 4. up, 1, 2, 3, 4. After we've done about 10 or 15 on that side, we just repeat the process on the other side. Again, up as fast as you can, nice and slow and controlled. It's all about controlling the movement. And I can feel my calves burning already. We'll do a few more with the double leg. Up, 1, 2, 3, 4, and one more. Up, down, 2, 3, 4. And there we go. 6 exercises that you can do in the safety of your home to help recover from osteoporosis and strengthen those bones. Now, it is important to keep doing these exercises and be very consistent. If you like this video, please like, please think about subscribing. It helps small channels like myself. And if you're looking for a video for osteoporosis that's going to take you to the next level, only when you're ready for it, I'm going to leave the link in the description. Thank you for watching and see you next time.